So good evening, everyone. My name is Heidi White. I am the Group Fitness and Wellness Manager at JCC Greater Boston. Special thanks to Beth Israel Deaconess Hospital Needham and Beth Israel Deaconess Medical Center for their partnership and for helping to coordinate the Wellness Speaker Series, including tonight's topic on achieving a good night's sleep with Rena Holzer. Rena is the Senior Nurse Practitioner in the Sleep Division at Beth Israel Deaconess Medical Center, an affiliate of Harvard Medical School. She is board certified as a family nurse practitioner and has been practicing for about 25 years. She is adjunct faculty at Northeastern University School of Nursing and has been a guest lecturer and clinical preceptor at Simmons Nursing School, Massachusetts College of Pharmacy and Health Sciences, and Boston College. Her professional interests include health promotion, the care of patients with complex medical issues, and patient education. Rena and her family are members of JCC Greater Boston, and her daughter attends Camp Kaleidoscope. Before I turn the screen over to Rena, a few things to note about tonight's event. Rena plans to present for about 45 minutes and will save time at the end to answer all your questions. Please type your question using the Q&A feature, not the chat feature. And I will be monitoring the chat along with Audrey Edwards, who is our Director of Health and Wellness. Since this is a webinar style meeting, we cannot see, we cannot hear you, and please use the Q&A for any questions or comments you may have. And so I'll turn everything over to Rena. All right.
All right. Well, thank you very much for inviting me. It's a pleasure to chat with everyone tonight. I know this is a very hot topic, so I'm very glad you all are here. Let me start by pulling up my talk for you. All right, good. So again, welcome. And today we're going to talk about how to get a good night's sleep. We will talk about some of the medical problems that happen when we sleep. But again, this is not a time for a diagnosis or a treatment for whatever is ailing you. We're just going to give you some information to help you get better sleep. Let's see if this is going to work. Here we go. All right. Good. So as this lovely cartoon says, you know that amazing feeling you get when you get into bed and go straight to sleep and then wake up in the morning feeling fully rested and refreshed and ready to go? Yeah, me either. You'll see I am a fan of cartoons that have something to do with sleep. We'll have a lot of those tonight, but I'm going to hopefully get you closer to feeling this way than you have been before. So we all know what this is. So now that I've got your anxiety level up, let's talk about your sleep. So this cartoon shows us that it says, I don't know why I feel so gross lately. All I do is avoid drinking water and stay up all night on my phone when I should be sleeping. Now, I know there's probably some nods out there right now going, oh, right, yeah, I do that. That's what we're going to try to avoid. So as we all know, we are in that time of uncertainty. COVID has really thrown a monkey wrench in everything we do. And that doesn't help our sleep at all. So this gentleman is in bed on his computer, which we'll talk about that's probably not the right thing to do. But he's saying, I was too anxious to sleep, too sleepy to work, and too lazy to go to the kitchen. I know that's what a lot of people have been feeling recently. So what are the common things that I hear about in my office? I'm having a hard time falling asleep, staying asleep. I'm waking up frequently and I can't fall back to sleep for some reason or another, or maybe I just can't turn my brain off at night. And gee, why is it easier to fall asleep on the couch in the evening than it is in my bed when I'm supposed to be going to sleep? We'll talk about all of this tonight. So I think this cartoon can hit home with many of us, given the pandemic and how stress has really played a key role in that for all of us. So there's a phenomenon called COVID-somnia, and it's insomnia brought about by a lot of different stressors regarding the pandemic. fear about the pandemic, financial concerns, limited socialization. And I think many of us, or most of the people I spoke to at the beginning of the pandemic, were having a lot of this. So I'll ask, and I know you can't answer me, but have you changed some of what you've been doing every day since the pandemic? Many of us are working from home now, so our bedtimes and our wake times have changed. Our daily habits have changed. Are you on your phone kind of doom scrolling more than you used to? Are you having childcare issues? These are all big stressors and can really mess up your sleep. So COVID-somnia is not just a term I made up. It is a real thing, and the American Academy of Sleep Medicine, or the AASM, actually did a study on this about a year into the pandemic, where about 2,000 adults were surveyed, and it showed that over half of them had some kind of sleep disturbance that was related to COVID-somnia. And what were the common disturbances? Difficulties falling asleep and staying asleep, sleeping less, having worse quality sleep, more disturbing dreams. I think Charlie Brown sums this up quite nicely. Dear mind, please stop thinking so much at night. I need to sleep. So let's start by talking about insomnia. And as I said, I'll talk about a lot of different issues with our sleep, and then we'll really talk about how to get it better. So insomnia is the most common complaint that we get in the sleep clinic. It's a manifestation of behavioral, psychological, and biological dysfunction. What does that mean? Well, all of us right now, I think, especially with COVID, are in this state of hyper-arousability. I like to think of it as we're all kind of vibrating all the time. The world around us is constantly changing. So this hyper-arousability state that we're in is not just at night, but it's throughout the day as well. And so again, you're having problems falling and staying asleep. Even though you have this whole opportunity to get a full night's sleep, it may not be happening. And perhaps you're waking up too early. A lot of us know the symptoms of insomnia because we've experienced it, but let me review it for some of you. Fatigue, concentration, memory, and focus issues. And because of that, poor performance at school, work, being a parent even, you can have poor work performance from that because we're moody or irritable. It can make our depression and anxiety worse. We can have a lack of motivation, and it can increase our accidents or errors. So a lot of adults have insomnia, according to the American Academy of Sleep Medicine. Who is more likely to have it is folks who are older, women, people under more stress. There are certain medical conditions that it can be more prominent in, and also those with mental health issues like anxiety, depression, and mood disorders. So sleep disturbances, how we define insomnia is a sleep disturbance with daytime symptoms. And as we said before, this can affect all aspects of your life. So insomnia is classified in a number of different ways. So we talk about it in the acute or short term, and some people say that that can be just a few weeks. Most sources will say it's up to about 3 months duration. This is transient. It happens a night or two, maybe a week. And the cause of it is acute illness, yours or someone else's, and emotional stress. Now, then there's the acute on chronic, which is sort of the medium term insomnia, which is about a month or more. And then you'd get into the chronic insomnia, which is more than 3 months in duration. And here you're having symptoms at least 3 nights a week. And again, what are the causes is this chronic stress, this hyperarousability. What contributes to this is our learned counterproductive behaviors. What does that mean? A lot of us, when we're having problems falling or staying asleep, try to pivot and give ourselves more time in bed, or we're trying to do more to give us more time to sleep. And some of those behaviors can actually be counterproductive. Getting in the bed earlier and just sort of waiting for sleep, staying in bed longer than you normally do, trying to give yourself more time to sleep. Insomnia causes are many. It includes stress, as we've talked about. Other sleep disorders, which we will talk about more, medical conditions, including pregnancy, menopause, pain. Pain is a real big disruptor of sleep. Mood disorders, irregular scheduling, substance use. And by substances, I don't just mean the non-prescription, but I mean the prescription ones as well. All medications, whether it be prescription or over the counter, have side effects, and they can be playing a role in your insomnia. Use of alcohol, caffeine, using it the wrong time of the day can cause your insomnia, and withdrawal from other chemicals as well. Environmental factors plays a real big role as well. A lot of people have a bed partner who may be snoring or doing something else, maybe coming to bed too late and disturbing their sleep. Or maybe it's too warm, too cold, too light, or too noisy in your bedroom. This is another cartoon, and I apologize, it's a little wrinkled because this is from an actual newspaper. It says, "Why are you still awake?" And the woman who's on her device reading says, "I started reading a fascinating article on insomnia, and now I can't sleep." So how do we treat insomnia? Well, first of all, we have to figure out if insomnia is really what we're treating, or is there something else going on? And so we have to figure out, is the pain, is it the mood disorder? Is it some other sleep disorder? Movement, snoring, clock time issues. But the big mainstay in how we treat insomnia is improving your habits, your daytime and evening habits, and what you do around sleep and how you think of sleep actually impacts your sleep. So for some, we can do cognitive behavioral therapy specifically for insomnia. And that really helps build up our sleep habits and get us into a better position to sleep. Now, a lot of people ask me about medications to sleep. And medication does have its role in sleep, but it's not where I usually start, okay? A lot of people will reach for the sleep aid. I recently took a trip down the sleep aisle at CVS the other day, and every time I do that, I'm always impressed by what is on the shelf. So diphenhydramine is Benadryl, and that is an antihistamine that has a lovely side effect of making you sleepy. However, it can make other sleep disorders worse, and definitely should not be using it chronically or routinely. Once here and there, maybe, but really it's not treating the problem. And I'll tell you, Benadryl is in pretty much every something PM, whether it's Tylenol PM, the PM is Benadryl. The other medication that people commonly use before they come to me is melatonin. So melatonin is a naturally occurring hormone that we produce in our bodies. And we produce the equivalent of about 0.3 milligrams. But in my walk down the aisle at CVS, what are the milligram doses available? 1, 3, 5, 10, and even 12 milligrams. That's a lot. Melatonin has its place in treating sleep disorders, but again, not something I tend to reach for or suggest patients reach for right away. If you take too much or at the wrong time, you can have hangover effect, you can have other side effects. So the best way to get healthy sleep is to be intentional about our sleep habits and our routines. So doing things during the day, your behaviors leading up to sleep and even during the day have a huge impact on how you're going to sleep that night. These habits of yours can either promote health or contribute to your sleepiness. And generally, just a few really small tweaks to your behaviors can make a big difference. Now, when I bring up tweaks to your behaviors, most people's fur goes up because making change is really, really hard. And change should be made in small increments, and don't try to make changes right away. So sleep hygiene That's defined as the habits and practices that are conducive to sleeping well on a regular basis. And again, these things can help you fall and stay asleep. So what are these things that we call sleep hygiene? Being consistent. We're all, as a parent, we're all really good at setting bedtimes and wake times for our kids. But a lot of times as adults, we think we don't need a bedtime and we can go to bed whenever we want and we can sleep late and we can do all of these things. That actually prevents us from doing well in our sleep. We really want to go to bed at the same time every day and wake up at the same time every day, regardless if it's Monday, Sunday, vacation. Really want to be consistent in your sleep timing. And you also want to set a bedtime so that you can get 7 hours of sleep. I usually suggest that people start with when do you have to wake up and work backwards to figure out when your bedtime should be. The other big thing is to make sure you're not getting into the bed until you're sleepy. And there is a big difference between tired and sleepy. Other things. Bedrooms are for sleep and for sex, and we have to remember that. There's really no room in the bedroom for screens, be it that giant TV you have on the wall or the little one that you have in your hand. Really, if we make sure that we're using the bed for those two things, the brain starts to equate sleep with bed, and that really helps reset our thinking. You also want to keep the bedroom quiet and relaxing. Sort of think about it as the spa, right? It wants to be cool, quiet, and dark. If it's too hot, too noisy, or too bright, you're not going to sleep. If you get into the bed with all those great intentions and you start, okay, I'm closing my eyes, okay, now I'm not falling asleep. Anxiety levels start to go up. What do? This 20 minutes that I have written here is sort of the guideline. It's not a hard and fast rule. I don't want you sitting there with your watch going, oh, it's been 20 minutes. I can't fall asleep. I got to get out of bed. No, it's really when that anxiety level starts to get a little edgy. That's when, if you're not falling asleep, you want to get out of the bed and do something in a different space. I usually recommend reading on paper, not on a screen. Maybe a magazine, something that's not using your brain very much. Something that's, as we would say in my house, light and fluffy. Limiting that exposure to light. All right. So in my little cartoon here, this woman is doing everything wrong, right? She looks very worried. She's in bed. She's got her phone right up to her face and the bright light is in her face. We really want to get off of our electronics at least 30 minutes before bed. Excuse me. This allows us to sort of start to unpack our day, and it gets us away from bright lights. You can see I'm very well lit, and I'm very happy that we did this program tonight more than 2 hours before my bedtime, so I can have all of this light around me, because at a certain time, I dim all my lights. So about 2 hours before bed, all the lights should get dimmed. So I like to think of it as if you're sitting in a room with 4 lights, be them banks of lights or lights on the table, you cut it in half. You don't want to be sitting in the dark, but you do want less light. And that's real important. Light is alerting. It wakes our brain up. And we really want to tell it to time to go to bed. That hormone we were talking about before, melatonin, it's actually brought on naturally by dim light. And so that's one of the reasons to dim your light 2 hours before bed. Other things that you should do. Save your big meals for earlier in the day. You really don't want to eat a large meal before bed. If you're hungry, a light snack is okay, but make sure it's healthy, that you're not eating, just cleaning out the fridge and eating all the junk. Just maintaining healthy things, right? The things you hear all the time. Exercise routinely. You're all members of the JCC. Go exercise. It's a good thing. and it maintaining your healthy eating, right? Making sure you're eating all the food groups, you're not just eating junk. Avoiding caffeine later in the day. I usually suggest to people they stop their caffeine at least as late as 2, maybe earlier. It really depends on you. Avoiding alcohol 4 hours before bed. Alcohol can actually exacerbate a lot of sleep issues, underlying sleep issues, and it can make your sleep worse. Many people try to self-medicate with alcohol to try to get them to go to bed. It's actually counterproductive. And if you're like many of my patients and you're really trying to pound your fluids because you know that's real healthy, stop drinking liquids about an hour or 2 before bed, because water in equals water out. If you're putting a lot of water in your body, you're going to need to get up to pee in the middle of the night. So the American Academy of Sleep Medicine and the Sleep Research Society put out a consensus statement about sleep back in 2015. And it said that adults should get about 7 or more hours of sleep on a nightly basis to promote optimal health. So sleeping fewer than 7 hours is associated with all of these adverse health outcomes. Poor sleep equals poor health. And I'll give you a moment to look at this. But all of the medical problems we want to avoid can be helped by getting better sleep. So this is a picture off of the CDC's website. This is based on old data, but this is what the CDC currently has listed on their website. And it shows that the US is a sleep-deprived nation. So the question I have for all of you is, did you get enough sleep last night? Over 35% of adults aren't getting the recommended 7+ hours of sleep. So I want to break down what's going on in this picture a little bit to talk about sleep hygiene. So we've got this human who's on the couch. It's clearly dark outside. They have their laptop with full bright light, but this person's sleeping. And in the foreground, it looks like there's a TV on as well. So all the things I just told you not to do, that's what's happening. So we need to get you better sleep quality. And I'll let you look at this for a moment. If you don't make time for your wellness, you will be forced to make time for your illness. So again, prioritize your sleep and your health. I can't stress that enough. So this is also from the CDC's website. In the dark blue, we have less than 7 hours of sleep. In the gray or light blue, however you see that, that's 7 to 9 hours of sleep. And what these bars are showing us is the sleep-related difficulty in doing these tasks. And what you see is that when you have too little sleep, you have more problems doing the tasks that you want to do. So sleep duration is very important. If we don't sleep enough, poor work performance, increased errors. If you're a school bus driver or you drive for the T, you have more errors potentially. If you're a chef, you might get cut while you're cutting things. There are other ways that you can have errors or injuries at work as well. There are economic and social benefits to getting enough sleep every night. The CDC also says that at least 28% of us aren't even getting 6 hours of sleep a night. I see that more in my patients who work more than one job or try to burn the candle on both ends. Now, there is something called long sleep duration, and that's when you're getting more than 9 hours of sleep. That may be appropriate for some people, and I'm not going to get into that tonight. But how much sleep you need is really influenced by a number of factors, both your genetics, your environmental factors, as well as your own personal medical issues. Sleep duration is very important. However, millions of people have untreated sleep disorders that are preventing them from sleeping well. And they might spend more than 8 hours in bed every night, but the quality of their sleep is not there. And as you may have guessed, you need both quality and quantity to feel good from your sleep. So healthy sleep requires adequate duration, quality, timing, regularity, and the absence of sleep disturbances and disorders. So let's talk about some general sleep disorders. Okay, so the US Department of Health and Human Services has a sleep objective. This is part of Healthy People 2020, which is a federal initiative to promote health. And I believe they come out with this every 10 to 20 years. And right now, the initiative is to get more sleep for people. So why is that important? Well, let's talk about why we sleep and what the function of sleep is. So for a long time, people thought sleep was, mini death, or you just sort of turned off and did nothing for however many hours. But really, it's very important in processing, memory consolidation, processing information. New pathways are formed in the brain when we do this. Sleep is also very important in cleaning out the gook in our brain. So it cleans out the spine, the cerebrospinal fluid, gets rid of all the junk, it clears out the lymphatic system. It also is really important in sort of every aspect of our health. Sleep has its fingers in every system in our body. So from cellular processing and regulation to immune function, to healing cellular levels, to hormone regulation, growth, and metabolism. So there are a lot of sleep disorders out there. They are very common. How they present is pretty varied, and a lot of times they get layered on top of each other, so it can be a bit confusing. So this is a schematic of some of the sleep disorders out there. They're very common. We're not going to talk about all of these, and I'm going to briefly touch on some of them tonight. Again, we're not here to diagnose sleep disorders tonight, just to give you an awareness of them. So let's talk about breathing disorders. And I'm going to highlight obstructive sleep apnea because that's the most common breathing disorder when we sleep. So this woman is saying, do you mind sleeping in the spare room? Your snoring is keeping the dog awake. I hear this a lot. And it's very common for my patients to sleep in separate rooms from their partners because of someone's snoring. So what is sleep apnea? So obstructive sleep apnea, as I said, is the most common form of sleep apnea. And what's obstruction? So that's when the airway collapses. Okay, so somewhere between the nose and about the level of the collarbone, throughout that airway, something is collapsing when we sleep. And that's closing off the airway, preventing air from getting in and getting out. And what can happen is we don't get oxygen to our brain. That puts strain on our heart, strain on our brain, and it can be the source of some serious medical issues and cause what we call intermittent hypoxia, which means we don't get oxygen to the brain. And it can exacerbate blood pressure issues, heart failure, atrial fibrillation. It can also exacerbate depression and anxiety and mood disorders and neurological disorders. Obstructive sleep apnea affects nearly 1 billion, that's with a B, people worldwide. All right, so this is a schematic of what I was just talking about. I hope you can see my cursor. So this is on the left of your screen. This is what a normal anatomy looks like. So here's our nose, we breathe in. And everything is nice and open. And here on the right, this person is lying down and everything sort of collapses, especially when we're on our back. So the jaw recedes a little bit, the tongue falls back, and that upper airway sort of collapses and it's not as wide open. And so that's the obstruction we're talking about. And every time our airway collapses, we're dropping our oxygen saturation, and that sort of wakes us up. Our brain goes, whoa, that's not good. And so that is produces like a chronic sleep deprivation. Again, sleep apnea is very prevalent. Greater than 80% of sleep apnea is likely undiagnosed. And so that is very important. There is a slight more prevalence in men than in women. But it's prevalent in everyone from all ages, genders, races, you name it, it is there for everybody. What puts you at higher risk for sleep apnea is if you're male, if you're over 40, if you're overweight, carrying a little more weight, if you have a family history of snoring. For women, if you're postmenopausal, because that's when we lose that protective estrogen that helps keep us without the sleep apnea. So what are the symptoms? Most people are aware of this: the snoring, the gasping, the choking, pauses when you're breathing, insomnia, as we talked about before, not always insomnia. It can be your sleep apnea. Needing to get up to pee at night, headaches in the morning, a decreased libido, poor memory, focus, concentration, mood issues. Women have sometimes a different clinical presentation. So with heart disease, heart attacks and such, we know that women have different presenting symptoms than men. It's the same thing in sleep apnea. So women tend to have more non-specific symptoms: morning headaches, fatigue, anxiety and depression, or sleep onset insomnia, meaning I can't fall asleep. So many of you might relate to this. It says, you know, when you're getting older when the term pulled an all-nighter means you didn't get up to pee at 3 a.m. So how do we diagnose sleep apnea? We do a sleep study. There are a number of ways to do that. I'm not going to get into all of that tonight. If you have sleep apnea, there are a myriad of ways of treating it. And again, I'm not going to get into all of that tonight because that's a whole different talk. But there are a lot of treatment options, and the options depend on the severity of your disease, because sleep apnea is a disease, and it also depends on the severity of your symptoms. I want to highlight a couple of things on this slide is the avoidance of alcohol and other medications, be it benzodiazepines or opiates. And again, we talked about this before, but those substances can worsen sleep apnea. You really want to avoid taking them less than 4 hours before bed, because it collapses that upper airway a little bit, because it decreases the muscle activity, and it can decrease the breathing drive. So other treatments that we have for sleep apnea include PAP, or positive airway pressure, which is a box and a tube and a mask interface. And as this upper cartoon shows, it puts air into that upper airway and stents it open so the airway doesn't keep collapsing. There are oral appliance. MAD stands for Mandibular Advancement Device. And this is a device that's usually made by a special sleep apnea dentist. And it's designed to go in, excuse me, in the mouth, upper and lower, and with some bars that basically pull the lower jaw forward, essentially opening up the back of the airway. You may have seen the Inspire ads on TV. They're pretty hard to miss these days. Let me tell you, I get asked about this all the time. Inspire, you see on TV, no mask, no tube, just a button, right? So the button is actually a surgically implanted device in your chest, where they run a wire up along the hypoglossal nerve, which is one of the nerves that innervates the base of the tongue. And this device sends, with the touch of that button, you turn it on in the evening, and that device sends little electrical current up to the base of the tongue to help move it out of the way. So now let's pivot and talk about circadian rhythms. So this is clock time, okay? So when our body clock is set, basically. And this is always in relation to local time. So here in Boston, generally socially acceptable bedtime is somewhere between 10 and midnight, generally speaking. Phase delay means you go to bed too late or later than is socially acceptable. Phase advance means you go to bed too early, again, not socially acceptable. And then there are issues with going to bed at different times because you work shifts. So phase advance, as I said, is going to bed too early, generally called a morning lark. As we age, our body clock age advances as well. So you may find as you age, you're going to bed a little earlier and waking up a little earlier. Phase delay, or going to bed too late, is like a night owl. This is actually very common in teens and people in their 20s There's a biology behind it. It has to do with our hormones. But contributing factors to this is being on our screens. And as we talked about, timing of light. So this is just a schematic of where normal is. That's in the light blue in the center. And if you have phase advance, that means you're going to bed too early. And if you're phase delayed, you're going to bed too late. This next slide sort of shows sleep drive in relation to the sun and the moon or the nighttime. This gray bump right here, that is when we sleep. So basically this is saying as the day progresses, our sleep drive goes up. As we sleep, it goes down. So what drives our circadian system? Meal times, interestingly enough. So having routine mealtime also helps ground your clock time. Sleep habits, as we've talked about, and light exposure, and timing of physical activity. So I have a lot of people who always ask me, so when should I exercise? If you tell me that exercise can affect my sleep, when should I exercise? And that's a really good question. I don't have a hard and fast answer. I have a few patients who tell me if I don't exercise by 8 a.m., I'm not sleeping at night. And I have other patients who can, go for a run on their treadmill at whatever time in the evening and clean up and go right to sleep. So it really depends on you. Let's now talk about movement issues. So there are things that go bump in the night, and it might be your legs rattling or other body parts. So we'll touch on this briefly. So the clinician here is saying if it only happens when you rub your tummy, it's not restless legs. So I can tell you that a lot of people come into my office and say, I think I have restless legs. Well, restless legs is a clinical diagnosis, and it also actually follows a circadian pattern. So there is a clock time that's related to it. And it's this interesting sensation that a lot of people just can't describe, but they have to move. It's driven by low iron stores in the central nervous system, or what we like to say, brain iron. And the way we treat it is, first of all, identifying what the underlying aggravators are. Now, antidepressants are very important, and if you need to take them, that's really important. However, if you have restless legs, certain antidepressants are better for not exacerbating or making worse your restless legs. Sedating antihistamines, again, going back to that Benadryl that you may be taking because you have insomnia, that may be making your legs worse. And again, alcohol and caffeine. Caffeine is a stimulant, and we think, okay, that's just going to prevent me from falling asleep. It actually can make your legs worse. And there are a lot of different ways that we treat it, and we'll leave that up to your clinician to figure out. So when should you seek medical advice? Well, you should call your primary care if you have persistent sleep issues that are interfering with your daily life. Your primary care is very well versed in a lot of these things and can start chipping away and figuring out what might be the problem. When should you see a sleep specialist? Well, when you've made all of your sleep hygiene changes and you've talked to your primary care and things still aren't working. That's really when you want to call us. So, in summary, sleep needs to be a priority. It's very important that you prioritize your sleep. Self-care is not selfish. We have to remember that we need to take care of ourselves. And by prioritizing ourselves, it's not a bad thing. So as we've talked about, sleep is just really important to all things health. The timing, the duration, the quality, the quantity, all very important. There are a lot of sleep disorders out there. They can adversely affect your sleep. So what do you need to remember, and what do I want you to take home from tonight's talk? Well, good sleep hygiene. Again, getting that set bedtime and set wake time, and really work on that pre-bedtime routine. And that may be partly I get into bed with a book and read for 20 minutes. It may be I meditate for a little while before I go to bed. but you really want to train your brain to say, okay, when I do this activity, it means we're packing up and it's going to be time for sleep soon. Changing some of the other habits, limiting your caffeine after 2 p.m., avoiding alcohol, again, taking that time to unwind, limiting your screens. I usually tell people to stay off social media and the news at least 30 minutes, if not an hour or two before bed, because that can get our fur up for everybody. Limiting, if you're going to take a nap, you really want to limit it or even try not to take that nap. You also want to avoid excess time in bed. So again, if you're not sleeping, don't be in the bed. Remember, bedrooms are not for worry. This is a little graphic from the CDC to help you remember what I just talked about. And so I wish you good and healthy sleep. This is actually a picture of my now tween when she was very little. And she approved and said I could put this in. So I'll open it up for questions now. I am gonna put the next slide up just so you have the contact information for my office. There are a lot of us in the office. There are about 5 nurse practitioners and probably about 7 or more physicians. And we all work well together, and we all see a variety of sleep disorders, and we're happy to see you. So thank you very much. Again, JCC, thank you for inviting me, and I look forward to answering your questions.
Yep, we have quite a few questions in the Q&A.
Should I stop sharing, Heidi?
Yeah, why don't you stop sharing so we can see you nice and big. And Audrey and I can just alternate asking the questions, and you can answer if that works.
Great.
So the first question is number of hours of sleep as important as the quality of sleeping?
That's a really good question. They are both very important. So adult humans are recommended to have somewhere between 7 and 9 hours of sleep a night. Okay. I personally am about a 7-hour sleeper. If I get more, that's okay. If I get less, I'm not doing so well. So I think you really have to know your body to see what works, but the 7 is the minimum.
Great. Next question, and I like the way this is phrased. What do you think about siestas, napping?
I think napping is fine. It depends on why you're napping. A lot of people nap because they're tired during the day, because they're anxious, because they didn't sleep well the night before. And I think that the driver of the reason for your nap would sort of flavor my answer. So if you didn't sleep well that night, if you sleep in the afternoon, you're likely not going to sleep again that night because you're borrowing from Peter to pay Paul. So if we really, if you need like a little power nap, 10, 20 minutes once a day, that's okay. Especially if you've like done a hard workout, you've been out shoveling the snow, whatever. But remember, you really want to put the majority, if not all of your sleep in the nighttime.
How can one measure oxygen to brain if reduced in obstructive sleep apnea?
So that's a good question. And unfortunately, I can't ask you any more questions right now. But if you have been diagnosed with sleep apnea, then someone has quantified the amount of oxygen desaturation that you're having. And likely, once they started you on treatment, has made sure that you are now getting oxygen to your brain, or at least has noticed that the treatment is improving your daytime function. And so that way we know that you're doing well. If you're curious, could you go out and buy an oximetry, an oxygen monitor? Yeah, they're all the rage now with COVID, so they're really easy to find.
This next question is about snoring. Is side sleeping better to decrease snoring?
Yes, that's the short answer. Snoring is not necessary pathology. That means it's not diagnostic of sleep apnea. It's a noise, it's a vibratory noise. So it's like, I like to think of it as when we were kids, we used to take blades of grass, put them between our fingers and blow and make a whistle. That's what snoring is that when the airway gets a little too narrow and air is moving through that and it's vibrating, and that's what's making the noise. So yes, sleeping on your back, gravity is going to throw everything to the back, collapse that airway more. So flipping you on your side when you sleep, yes, should decrease your snoring.
Is reading a book, so not on a screen, but reading an actual book before bed a bad idea?
No. However, if you're like some of my patients and myself, if you pick up a murder mystery right before bed, it may be bad for your sleep because you might want to sit there and read it all night. So what I recommend is having 2 sets of books, your daytime reading and your nighttime reading.
Okay, so this participant has a question about hyperarousability. He is from what you've spoken about, he feels that hyperarousability characterizes the quality of his sleep. He says he wakes many times during the night, more toward the morning, sometimes for a short time, other times for half an hour to an hour. His sleep hygiene is very good. Is there something recommended for this?
I would talk with your primary care first. I think you've done all your due diligence to work on your sleep hygiene. Now is the time to pull the trigger and see a medical professional.
This person says their deepest sleep seems to be in the morning. And what's that all about?
So I assume by deep sleep, you mean dream state. And that actually makes sense. Because as our night goes on, we actually sleep in larger chunks of REM. So REM meaning dream state. We sleep in cycles. So they're about 90 minutes of each cycle. And as the night progresses, we get incrementally more REM. And so deeper sleep later in the night or earlier in the morning, however you want to look at that, is normal.
This person has a little business question, wanting to know if they will need a referral to have a visit with you.
That's a good question, and that would depend on your insurance. But you can feel free to call my office or talk to your primary care's office, and they can help you with that.
Is there such a thing as sleep procrastination?
That's a good question. I'm sure that is a phrase somewhere, but I understand what you're talking about. There is a phrase that I've heard recently that's similar, and I'm blanking on what it was. But yes, and we've seen it a lot since the pandemic started also. Oh, it's going to bother me. I'll have to get back to you what that phrase really is. But yes, people procrastinate for all sorts of reasons. That's one of the reasons I tell people to get off of screens, because if you've ever been really tired and stood in front of your TV, it's like they're drawing you in, right? And you just can't stop watching or scrolling. So yes, I would recommend working on your sleep hygiene and very slowly chipping away at that.
You spoke a little bit about how many hours of sleep were healthy. This person is asking, are there people that only require 4 to 5 hours of sleep a day?
Generally, that is not healthy. Okay, again, 7 hours is the recommended minimum. Are there humans out there that don't need that much sleep? Yes. If you feel you're one of them, you might want to check with a medical person first before we sort of stamp you and say, oh, short sleeper, because we want to make sure that we're looking at all of your health and we're not being detrimental to it.
Can you talk a little bit more about the treatments for menopause-related sleep disorders?
I usually defer menopause treatments to, if we're going to talk about hormones, to the OBGYN. Okay. And I really tailor treatments to the individual and what their story is. So first things first, we got to deal with the hot flashes we got to deal with the bed partner, and we've got to deal with your sleep hygiene. And I would usually start there. But I'm happy to see you in my clinic to talk about it further.
Next question. How do you distinguish between snoring and sleep apnea?
You get a sleep study. And that's the simple answer.
Okay. And I think this gets to the quality of sleep. Does it matter if the number of sleep hours are uninterrupted, but as long as you get the appropriate number overall?
So yes and no. So really, again, it's going back to the quality as well as the quantity. And if you've got the quantity, but it takes you 14 hours to get 7 hours of sleep, that's not good quality, right? That means you're waking up frequently. And so you're disrupting your sleep. So you're not getting you really want to be able to sleep the whole night, or 1 or 2 wake ups, but not multiple throughout the night.
I love this question. Where, I have my own answer for this, it's not correct. Where, if not in the bedroom, is a good place for me to worry?
That is a really good question. Anywhere else in the house? Not in the pantry, not in the refrigerator. Okay. The hope is that we sort of try to tamp our worry down because we're working through all of our issues, and we all have issues, but not the bedroom. The living room is fine, the hallway, the bathroom, but we really want to try to park our worry outside of the bedroom. How you have an umbrella stand, you might want to have a worry stand.
This question has to do with melatonin. This person takes 5 milligrams if he wakes up in the middle of the night and cannot fall back to sleep, generally not more than 2 times per week. Is this okay? And what else can he do instead of taking melatonin?
So I'm going to speak in very general terms because I don't know your medical history. And so I can't really give you detailed information. So I'm going to speak in some broad strokes. 5 milligrams is a lot. In the middle of the night is the wrong time. So remember, I was talking about the right time, and that maybe you might have a hangover later in the day if you take darkness, right? The melatonin is sort of the sleep hormone, right? I recommend taking it before you go to bed, and a lot less. So you are taking about a little more than 10 times what the body produces. And you're taking it many hours after the body would have produced it, and it's already starting to decrease its normal or natural dosage. So you may want to talk to your primary care or even a sleep provider to really figure out what the driving force is for your wake ups in the middle of the night and how we can help you sleep better.
Next question. Is there a recommended sleep duration for adolescents?
Yes. And I will refer you to the American Academy of Sleep Medicine or the CDC's website. And it goes through on each of those, there's a chart, I believe, I think it's on the CDC's as well, where a chart for each age group, because depending on the age, there is a difference. Off the top of my head, I haven't worked with young adults or teens for a while. I mostly work with adults. I did used to work at Children's Hospital, so I have a little bit of experience with that, and I have my own tween. But they generally need north of like 9 to 10 plus hours a night. Again, teens and tweens, a lot of brain growth, a lot of hormonal issues going on. We really need sleep to promote good health and also knowledge from school. So if you cram for an exam and you do an all-nighter, there actually is a lot of research out there that says you're going to do fine on the test, but you're not going to remember it if I test you a week or 2 later. Mm-hmm. So if you get that good amount of sleep, you study, and then you get a good night's sleep, you're going to do better on that test.
So this person, reading helps them go to sleep. And they want to know if reading a book with a light on, or not a light on, but using some sort of light, is better or worse than using an iPad, so using a screen?
Yep. So I haven't looked at the recent research on that. I personally prefer to read on paper because I think you're getting less light exposure. So in our house, we have little book lights that kind of clip onto the book and have very low lumens or light amount that's coming from it, just enough to illuminate the book. And it's not right at your face, but it's pointed down at the book. So it's limiting the amount of light exposure you get. If you're reading on a device, many of them, but not all of them, have a night mode where it decreases the contrast. It's sort of white writing on black background, but there's always the concern of, are you getting more light exposure than you need?
Any suggestions for getting back to sleep after waking up to use the restroom?
So again, that's a really good question. Trying to not let your brain go down that rabbit hole is sometimes really hard. So not pulling out the screen. A lot of people will do meditation, progressive relaxation, counting sheep. That's part of what we're talking about, right? Other people will listen to a podcast if they're having a hard time. Just have that queued up and ready to go, so you don't have to be on your phone looking for it. You can listen to music. Again, things that are calming and quiet. Some people need to sit and read their book for a few minutes and get drowsy, and then they fall back to sleep. Books are really good because they take our brains and don't allow us to go down that rabbit hole. We get into a nice story or something instead. So and it sort of differs for every individual. Some people, I was just talking to someone the other day, one of my patients who I was recommending listening to music. He goes, well, I actually compose, so that won't work for me because I'm very critical of listening to music. So you really have to find what works for you.
And I know you mentioned meditation. This question is there a good meditation routine to do before you go to bed? Is there one that you recommend?
That's a really good question. There are a lot of really good apps on the market these days. Some of the bigger ones are Headspace and Calm. And they sort of exploded during the pandemic because of COVID insomnia. And I have a lot of patients who use them and really like them. They have some free parts of them, and then there are paid parts of them too. So check it out.
I also just want to add that JCC on our virtual platform, JCCGB Plus, we offer a guided meditation, which is a 10-minute meditation 3 times a week, and we record those. So those are available on demand as well for members.
Perfect if you can't fall back to sleep after the bathroom.
Right.
How do you feel about the snooze button?
I use it. You just can't abuse it. Again, you really want to have the wake time be the wake time. So you're not hitting snooze 5 times and waking up an hour later, right? You can wake up with the snooze, hit the snooze bar and just sort of sit there and prepare yourself for the day. And then when it goes off, get up. You really, I know a lot of people build in time into their morning routine so they can snooze 10 times before they get up. I'll tell you, your sleep quality and quantity will be better if you wake up about the time you really need to get out of bed, and then you don't have as much fragmentation.
Another question about the clock. Should you look at the clock when you wake up before your normal time?
It's a good question. It depends. If that's going to send you down the rabbit hole of, oh my goodness, what time is it? If I don't fall back to sleep now, I'm only going to get this much sleep tonight, then don't look at the clock. If your clock is your phone, I would suggest not looking at it, okay? Because again, of the light. So it really sort of depends on how it will affect you. Any other questions?
This person, when they have trouble falling asleep, they get 4 to 6 hours of sleep total. The next night, they'll get 8 to 10 hours to compensate. The next night, the pattern continues. What is the best way to recover from a bad night of sleeplessness?
So again, going to bed at the same time every day, waking up at the same time every day. That is so important because that's going to reset your clock. If you try to, I had a patient who worked in finance, and he eloquently said, sleep is a commodity, but you can't hoard it. You can't trade it. You either have it or you don't. And so you really need to protect it. Bedtime, wake time. If I had crummy sleep, bedtime, wake time. Because if you have crummy sleep, you're actually going to improve your sleep drive for the next night. So it will help reset things.
I think you might have just addressed this question, but it says it seems like having a consistent bedtime is inconsistent with going to bed only when you are sleepy.
Again, I think I did, Heidi.
Yeah.
Really, you got to work on looking at when do you have to wake up? Count back 7 to 9 hours and whatever your body needs. And that's when, so if it's inconsistent for you, then I think about, well, is your clock time off, right? Are you having any circadian issues? Or what else is going on? Are you trying to go to bed too early? Are you not getting, so we're looking for what else is going on in that situation. So you may want to call your primary care and have that discussion.
If someone's trying to improve their sleep hygiene, what's your recommendation for the first step, the first thing they should focus on?
Timing. Again, setting a bedtime where you can have that time, keeping that worry in the worry stand outside the bedroom. If you have anxiety, okay, if it's not well treated, call your prescriber or someone, your therapist, and really work on that. That is a huge driver of poor sleep hygiene, is that we just have so much worry that we can't even get to that first step.
Is it a good idea to take a hot bath or shower to help you fall asleep, or drink hot milk?
So warmness, right, keeps us nice and cozy. It gets us ready. Some people put heating pads or warm up the base of their bed so their feet aren't cold. Whatever works for you to get you into that routine, you can make that part of your bedtime routine. So you can say, I always take a warm bath so many minutes before bed, and that becomes part of your sleep routine. Again, a glass of warm milk is fine as long as it's not accompanied by a huge meal. You're okay. That small snack would be fine.
This is a good one. Is there a nearby sheep farm where I can count sheep?
I don't know, but I bet, I haven't looked for this, but I bet there's an app for that.
Love that question. All right, last question. Any advice for falling asleep with jet lag?
So I think that's a conversation that's a little more in depth. So let me give you a little bit of information on that. So when we don't go to bed at the same time every day, if we are going to bed and waking up at this time on a work day and this time on the weekends, we're giving ourselves what we call social jet lag. So we didn't ever gotten onto the plane and we never flew out to California and didn't have to come back, but we're doing it to ourselves. Time is really important, and light. And because that's all clock time. Jet lag is clock time and circadian rhythms. So when you're jumping multiple time zones, it sort of depends. Did you go forward? Did you go back? So time and making sure that you're getting good light exposure.
Great. Wow. I think we went through all the questions and all the answers. So thank you.
They were great questions. Thank you, everyone.
Really great.
So I just want to thank Rena, and special thanks to Beth Israel Deaconess Hospital Needham and Beth Israel Deaconess Medical Center for sharing this important information about achieving a good night's sleep. And if you would like to hear this presentation again, or if you know someone who might benefit, we will be posting the recording on the JCC Greater Boston website on the Wellness Speaker Series page. or you can also access the recording via our online video platform called JCCGB Plus. And if you have any questions about JCC Greater Boston's programs, you can also email me. My email is hwhite@jccgb.org. And Rena, you provided your contact information. Do you want to just provide that information one last time?
Yeah. Let me put that up. I'll just share my screen.
Perfect.
There you go. And we are happy to see you.
Great. All right.
Thank you so
Thank
much.
you so much. Good night,
Thank you
everyone.
all.
Thank you
Thank
all
you
for
very much.
coming. Thank you, Rena.
Thank you, Rena.